So, let us start this with the main topic, which is the postpartum hemorrhage. As you can see on the screen, it is the color brown that is encircled. So, on the top of that, you can see a yellow box, which is the etiology. So, it said that etiology are related to hemorrhage triggered by A. So, A is the continuous bleeding in the uterus. So, as you can see, beneath the yellow box is also a green box, which means the pathophysiology or pathophysiological events of how the bleeding occurs. So, first, it starts with the mechanical events, followed and mediated by hormones, then followed by a strong uterine and muscular contractions, the myometrium and decidua. After that is that the spiral arteries fan out to create a low resistance vascular bed in the intervillous space. Then, the placental blood flow occurs. Now, let's move on to the light brown box that you can see on the screen. It is the desired outcomes, and it comes into two factors, which is the predisposing factors and precipitating factors. So first, let us start with the predisposing factors. So first is the placenta accreta. So placenta accreta is a serious pregnancy condition that occurs when the placenta grows too deeply into the uterine wall. So second, the placenta previa. So, the placenta previa is a problem during pregnancy when the placenta completely or partially covers the opening of the uterus or cervix. Now, let us move on to the placental abruption. So, the placental abruption occurs when the placenta partly or completely separates from the inner wall of the uterus before the delivery. And lastly is the overdistended uterus. So, it is said that it is to be present when the height of the fundus is greater than the gestational age. So, that's all for our predisposing factors. Now, let us move on to the precipitating factors. So, first is the fetal macrosomia, or fetal macrosomia is used to describe a newborn who's much larger than average. So, it is indicated on the screen that it is over 4,000 grams. Next is the pregnancy-induced hypertension, or gestational hypertension. So, this condition happens when you only have high blood pressure during pregnancy and do not have protein in your urine or other heart or kidney problems. So next is the severe vaginal or perineal lacerations, or also known as a vaginal tear. So it is a wound in the tissues of the vagina. And lastly is the weight gain over 50 kilograms during pregnancy. And that's all for the precipitating factors. Let us move on to the next or following branches of the postpartum hemorrhage.
So, tissue perfusion is described as lack of oxygenated blood flow to the areas of the body. So, basically, there's an interruption of blood flow to the blood cells. So, based on the NCP that we did, the patient is at risk of ineffective tissue perfusion related to hemorrhage as manifested by blood loss, irritability, restlessness, and discomfort in walking. So now for the independent nursing intervention, first is we need to massage the uterus. This is to help expel clots of blood, and it is also used to check the tone of the uterus and ensure that it is clamping down to prevent excessive bleeding. Next is to monitor the vital signs frequently, as early recognition of possible adverse effects allows for prompt intervention. So for the dependent nursing intervention, we need to administer uteronic medication such as oxytocin to increase uterine tone and lessen blood loss. So now for the collaborative nursing intervention, we need to refer to physical therapists for instructing the client in exercises that promotes relaxation and visualization, as this enhances the patient's coping abilities by refocusing attention. So now for the health teaching, first things first is we need to encourage the patient to lifestyle behavior to improve blood flow such as minimal exercises. Next is to teach the patient to recognize further signs and symptoms that needed to be reported to the nurse. Lastly is to encourage the patient to take rest to prevent fatigue and poor tissue perfusion.
Urine atony refers to a poorly contracted uterus that does not adequately compress large open vessel at the placental site, which can result in hemorrhage. So for the symptoms is prolonged or excessive bleeding from uterus. For the nursing diagnosis, this risk for hemorrhage as manifested by heavy bleeding, pale skin color, painful lower abdomen, and back pain. For nursing intervention, independent is massage the uterus gently to cause it contract. Also provide additional or maintain existing IV infusion of lactated ringers. Last is monitor the vital signs frequently. For dependent intervention, administer uterotonic medication like oxytocin and prostaglandins. For collaborative intervention, refers to physical therapists to launch uterine massage effectively. For last part is health teaching, initiate postpartum teaching early. Also provide clear and concise messaging. Last is provide valuable life-saving information. Rely on them to communicate timely and accurate.
Deficient fluid volume refers to blood flow to the brain and the kidneys decreases as blood loss continues and fluid is conserved. So reduction in blood volume with increased heart and respiratory rates. For the nursing diagnosis is risk for excessive blood loss after birth as manifested by bleeding, pale skin color, restlessness, and presence of valvular hematoma. For nursing intervention, first is independent intervention. Assess and record the color, amount, type, and site of bleeding. Also monitor vital signs every 15 minutes for 1 hour and every 4 hours for 24 hours. And administer IV fluid, blood, or blood products. For dependent intervention, administer uterotonic medication, which is the oxytocin. For collaborative intervention, refer to nutritionists for appropriate food to take in order to get desired intake and output and urine-specific gravity as indicated. For health teaching, educate the patient on the importance of oral intake and the potential causes of dehydration. Lastly is educate the patient and family on how to measure a 24-hour intake.
So we have here risk for infection. It is a state in which an individual is an increased risk for being invaded by pathogenic organism. For this NCP, our nursing diagnosis is risk for infection related to retained placental fragments. So risk for infections as manifested by abnormal vaginal discharge with presence of blood, soreness and swelling in abdomen area, and high fever. For our nursing intervention, we have independent intervention. We need to educate the client about proper hand hygiene, hand washing, self-care techniques, and also proper perineal care. We also have to position the clients on semi-Fowler's position to facilitate locha discharge or drainage. We need to use aseptic techniques for all wound care and invasive procedure and ensure the removal of vaginal packing as indicated. For dependent intervention, we need to administer medication for infection as ordered, like antibiotics through IV route and methylergonavine. Lastly, for collaborative, we need to consult a nutritionist for a high protein, iron, and vitamin C diet. Also, we need to consult medical technologies to obtain a gram stain or cultured and sensitivity if locha is noted to have an odoriferous smell.
Okay, so for the complications, increased heart rate, rapid breathing, and decreased blood flow. These symptoms can restrict blood flow to your liver, brain, heart, or kidneys and lead to shock. And lastly, for the desired outcome, the aim of treatment of postpartum hemorrhage is to find and stop the cause of the bleeding as soon as possible and manage the signs and symptoms.